Hello, in this session we are going to talk how to approach a short case of ganglion. This is also a very common surgery short case. So for a lung, our usual examination order is SPACEPIT. The first part is 5S: side, shape, skin and surface. Second part is the PACE: plane, attachment, consistency and edge. Our third part is the PEAT: pulsatility, inflammatory changes and the transillumination. For our first part, this 5S, side. The ganglions are usually most common over the dorsum of hand and foot near joints, and they are usually small in size. Their shape is hemispherical. And the skin, we have to check for the scar because ganglion have a recurrence rate, high recurrence rate. The surface is smooth. The second part is the base, the plane. We have to check for the plane. Usually ganglion's plane is subcutaneous. And the attachment is ganglions are not attached to skin. They are always attached to joint capsule or tendon sheath. We have to check the mobility with the attachment by contracting the underlying tendon. Okay, if the ganglion is in the dorsum of the hand, we have to ask the patient to maintain the fingers in extension. And you have to apply resistance by downward pressure on extended fingers. So we can assess at the same time the mobility of the lung both vertically and horizontal. And the consistency. Consistency is soft to firm. It depends on the tension of the fluid within it. And the edge. Edge is well defined in ganglions. Our third part is the P, pulsatility. The ganglions are not pulsatile, but they are fluctuant. And sometimes it may be difficult to elicit due to its small size. There are usually no inflammatory changes like warmth, erythema or tenderness. And they are brilliantly transilluminant because the ganglion have a clear fluid in it. So the definition of ganglion is a cystic swelling related to a synovial line cavity, either a joint or a tendon sheath. For the management of ganglion, we can go for non-surgical or surgical approach. For the non-surgical approach, we have to watch and wait, and we can aspirate. If we aspirate, there is a chance of recurrence. There is a high chance of recurrence. And for surgical approach, we can go with the complete excision. And in the surgical approach, we have to be cautious about the complications of the surgery, like recurrence, damage to the adjacent nerves and vessels, and the wound-related complications. That's all. Thank you.